Hello, everyone. Can you hear me? Yes, I believe I'm on. So my name is Nneka. I am a postdoctoral fellow in the Center on the Ecology of Early Development. And in this study, we were really interested in examining the relationship between a caregiver's experiences of discrimination, their access to material resources, their concern for their children's experiences of discrimination, and Black children's behavioral functioning during COVID-19. And so when I'm referring to we, I'm talking about the researchers investigating social, cultural equity and race network. We are funded by the Robert Wood Johnson Foundation. We are a group of scholars at various different levels who are committed to impacting how racism is an environmental context that erodes health and education opportunities. We are conducting applied child development research focused on the positive development of Black children, so prenatal to age 8. So at the peak of the pandemic, we were contacted by a group of researchers in Oregon who were conducting the rapid assessment of pandemic impact on the development of early childhood. And so this survey is an early childhood family well-being survey. And it's a survey that goes out across the US about weekly to survey how children and families are doing during the pandemic. So children 0 to age 5. And the Riser Network was contacted to expand the survey to include questions about racism and discrimination. And so what do we know about this dual pandemic? So we know that at every level, everyone is being impacted by COVID-19, but we know that Black families are disproportionately affected by COVID-19. And we see this when we think about finances and health outcomes. From the rapid survey, we know that 40% of white families compared to over 50% of Black families reported having difficulties paying for material resources. When we looked at differences by incomes, we did see similarities for low-income white families and low-income Black families. But then when you look at the middle to higher income families, we saw differences between the white and Black families. And so for me, this highlights that it's not, race does not, or income actually does not shield Black families from these disparities. And in fact, race and really systemic racism and discriminatory practices continue to disproportionately expose Black children and families to less than optimal resources. And so we were really interested in looking at caregivers' access to these resources that are usually seen to promote children's optimal development, and really thinking about how it's affecting Black children's internalizing, so thinking about anxious and fearfulness, and their externalizing behaviors as well. And so the two questions that are guiding the study: one, what is the link between material resources, so thinking about childcare, lack of health promoting resources, and material hardship, and Black children's externalizing and internalizing behaviors during the pandemic? We were also really interested in looking at to what extent do caregivers' experiences of discrimination and their related concern for their children's experiences of discrimination moderate that relationship between their access to resources and Black children's externalizing and internalizing behaviors. And so our study consisted of 704 Black families. As I mentioned, we came in to add in questions about racism and discrimination. And so parents or caregivers who answered those questions, there was about 211. And so that significant drop in the sample size is really due to the timing of when the Riser Network came into the study. And so we're hopeful that as the survey is continuing, that we'll actually have more families answering these questions. And you can see that it wasn't as diverse as we wanted it to be. So we didn't have the diversity within the Black family in terms of immigrant populations and different languages spoken as well. And so when we think about the variables that were included into this study, so when we think about the outcome variables, we were really interested in looking at parents' reported behaviors of their children's externalizing and internalizing behaviors. We also wanted to control for their parents' reports prior to the pandemic. So we got data about how their parents reported their children's behaviors before the pandemic as well. When we thought about our independent variables, we had two composite variables, so lack of health promoting resources. And this really had things to do with whether or not the parent had health insurance, did their children have health insurance, did they miss a well baby visit, and also the caregiver's experiences of mental health. So thinking about depression, anxiety, loneliness. In the material hardship variable, so this is thinking about, did they see a decrease in income? Did they have difficulty paying for things like utilities, housing? Did they have a change in employment? And then we also looked at difficulty paying for early care and education opportunities. As I mentioned before, for the moderating variable, we looked at the caregivers' experiences of discrimination, but then also their concern for their children's experiences of discrimination. And so we also wanted to make sure that our sample, our subsample, so those who only answered questions about the racism and discrimination, that they didn't differ from the full sample. And so you can see that they're fairly similar, and the only difference really is in the subsample, we saw higher reportings of externalizing during the pandemic, and the parents' ages, they tended to be older in the subsample. And so for the full sample, so that 704 Black families, we were really looking at the connection between resources and externalizing behaviors. And then for the second question, that is when we brought in those who answered questions about their experiences with discrimination and their concern for their children's experiences with discrimination. So in our first model, what you can see is that the higher reporting of a parent's, the higher a parent reported the lack of health promoting resources was related to a child's externalizing behaviors and internalizing behaviors. So the higher reporting of lack of health promoting resources was about 49% more likely to report that their children were externalizing behaviors, and 34% more likely to report that their children were internalizing behaviors during the pandemic. We also see that material hardship was also related to internalizing behaviors. So the higher reports of material hardship was actually related to 65% more likely to report that their children were internalizing behaviors during the pandemic. When we added in a parent's experiences of discrimination, we see that, so the top half of the table is the main effects, and then the bottom half is really looking at a moderation or interaction effect, and I'll explain that in a bit. But the top half, you can see that while parents' experiences of discrimination was not significant, it really did help us get a better context for how we understood the relationships between resources and internalizing and externalizing behaviors. So even adding in a parent's experiences of discrimination into a model, we still see that lack of health promoting resources and material hardship was still significant. When we tried to look, so this is the bottom half of the table, we wanted to look at an interaction between the parents' experiences of discrimination and resources. So did the level of experiences of discrimination differ across some of these outcomes? And we saw that there was no significant findings in that. For the next model, we then wanted to introduce a parent's concern for their children's experiences with discrimination. We actually see that a lack of health promoting resources and material hardship was still significant. And now we also see that parents' concern for their children was also significant. So you can interpret this as the more a parent reported concern for their children's experiences with discrimination was related to being 68% more likely to express that their children were externalizing behaviors during the pandemic. So a few key findings that I hope that you take away from this is, one, that COVID-19 is affecting Black families in a variety of different ways. We see that lack of health promoting resources was associated with 49% more likely to report that their children were fussier or more defiant, and 34% more likely to report that their children were anxious or fearful. We know that greater material hardship was also associated with 65% more likely to report that their children were anxious or fearful. And we see that a concern about their children facing discrimination was also associated with being 68% more likely to describe their children as being fussy or defiant. And so we wanted to highlight that during the pandemic, this is actually one of few studies that actually focuses on Black children's behavioral functioning. The timeliness of this data is really important to be able to connect this to policy solutions now. We see that access to resources is actually associated with children's behavioral functioning. We also find that concern for their children's experiences with discrimination is associated with children's externalizing behaviors. And we know that in the field in general, very few studies actually look at the relationship between racism, discrimination, and Black child outcomes, so children at the very early stages of development. So one of the things I really do like about our center and really the Rise Network is that we are very adamant about connecting our research to policy. So how do we make action from the research and the findings that we get? And so one of the things we recently did was to release a Black Parent Voices report. And so this report really did center the voices of Black families and their experiences during the pandemic. I will drop that link in the chat so you're able to download the link as well. And so this was a very great webinar. There was about 1,200 people that registered for it. And it really, the ending part of the policy report does give examples for policy solutions. So what do we do now? What do we do moving forward? And so I welcome you all to in our breakout rooms to what questions do you have about this study? What thoughts do you have? How should we dig in deeper? And then I'm also excited to share some next steps that we have as well. And I know that there's so many great talks to choose from. So if you can't join this one, you should feel free to email us and I'm happy to respond.